What is research and what it isn't, and who is a human subject anyway? Explaining the common rule in plain language. This webinar is presented by the Health and Human Services, Office for Human Research Protections, Division of Education and Development. A disclaimer before we get started. Any opinions expressed in the course of this presentation are those of the presenter and do not necessarily reflect the policy of the Department of Health and Human Services or the Office for Human Research Protections. Any references to the regulatory provisions in the Common Rule in this presentation have been simplified to facilitate understanding. Always refer to the actual text of the Common Rule available on the OHRP website for a complete and accurate description of the regulatory requirements. The hyperlink provided on this slide will take you to that page. Our learning objectives today are to review and explain the regulatory definitions of research and human subject, provide examples to demonstrate what does and does not constitute research and who is not a human subject, and lastly, review when the regulatory requirements apply and when they do not. I've already mentioned the Department of Health and Human Services and the Office for Human Research Protections, but let me just say a bit more about who these entities are and what they do. The Office for Human Research Protections, or OHRP, is a small office within the U.S. Federal Department of Health and Human Services, or HHS. OHRP provides leadership and coordinates with the federal government and various departments and agencies in their effort to protect human research participants for the research that the federal government supports or conducts. OHRP holds the regulatory authority for the HHS policies for human research protections that are codified at 45 Code of Federal Regulations, or CFR, Part 46. Now, there are 5 subparts to the HHS regulations at 45 CFR 46. Subpart A is what is referred to as the Common Rule. We refer to Subpart A as the Common Rule because it is commonly followed across the U.S. federal government by 20 federal departments and agencies. The Common Rule provides the foundational regulatory framework for human research activities that are funded or conducted by the federal government. Note that each Common Rule department or agency is responsible for the oversight of the research that it supports or conducts. 3 other subparts, B, C, and D, provide additional regulations to protect certain groups of vulnerable populations. If you are receiving money from HHS to conduct human subjects research, and that research is not exempt from the regulatory requirements, and I'll explain what all these things mean in coming slides, you must follow all these subparts, assuming subparts B, C, or D apply because your research involves vulnerable populations. I should say here that the regulatory framework provides a baseline standard for human research protections. Compliance with the regulations itself does not mean that the research has no ethical concerns or that it presents no risks to participants. I just said in the prior slide that if you are receiving money from HHS or another Common Rule department or agency, and your research is not exempt, you are required to comply with the regulatory requirements. So there's a lot in that statement, and I'm going to tease it apart now. Generally speaking, regulatory requirements apply when a project is non-exempt human subjects research. This means, among other things, that an IRB is required to review the project according to the regulatory requirements and criteria, and that informed consent regulatory requirements apply unless they can be waived. Now, regulatory requirements typically do not apply when a project is not research, or when the project is not human subjects research, or when the project is research, does involve human subjects, but is otherwise exempt from the regulatory requirements. When the regulatory requirements do not apply, investigators and institutions have flexibilities for the way that they review and conduct these studies outside of the regulations. For example, there's no predetermined review requirement to satisfy or requirements for informed consent. Institutions can develop their own policies for these things, and they can also take into consideration the type of research they're reviewing, their institutional culture, the level of training of their investigators, etc., and make decisions accordingly. The thing to keep in mind is that even when the regulatory requirements typically do not apply, both institutions and researchers still have the ethical responsibility to protect the research participants' basic rights and to ensure their welfare. This means paying utmost respect to the people who participate in your research, maximizing the benefits that we could get out of doing the research, and balancing the burdens and the benefits of the research. This presentation is going to be focused on key terminologies in the Common Rule, so let's step back to these key terms now. Now, this next part is very important. To determine if the project you're proposing as a researcher or reviewing as an IRB administrator or IRB member is non-exempt human subjects research, ask these questions in this sequential order. And the questions are: does the activity involve research? If yes, does the research involve human subjects? If yes, is the human subjects research exempt? All of these terms have clear regulatory definitions, which I am going to describe in the coming slides. So, how do the regulations define research? Research refers to a systematic investigation, including research development, testing, and evaluation, designed to develop or contribute to generalizable knowledge. The key words in this slide are bolded for emphasis: systematic investigation and designed to develop or contribute to generalizable knowledge. Generally speaking, a systematic investigation would involve something like a hypothesis and a systematic approach, or perhaps a detailed plan, to answering that hypothesis. And typically, we would think of contributing to generalizable knowledge by drawing conclusions that are applicable to other similar cases, or that we know are broad, or not case-specific. We would contribute to generalizable knowledge by doing something like presenting our research findings at a conference, or publishing our research findings and generalizable conclusions in a journal. Let's look at an example. A team of physicians sees a patient with an unusual combination of symptoms. They run different diagnostic tests and procedures, but the results of the test do not yield a known diagnosis. So they write up a case summary of their observations of this single case and single patient and submit it to the medical journal for a publication. Is this research? No, this is not research, because the actions of the medical team did not consist of a systematic investigation. They did not start off with the research hypothesis and then do things like run specific tests to answer that research hypothesis or question. Further, while they published the summary of their case, the information that they published was not generalizable to the broader population or to similar cases. And so what they published was not a contribution to generalizable knowledge. Okay, what about this example? That very same group of physicians identifies a number of case reports in the medical literature of patients with similar disease presentations. They develop a hypothesis that all these different patients suffer from the same disease, and they want to systematically review these cases to identify characteristics and commonalities that would help them better understand this disease. They hope that this thorough investigation will allow them to add to the body of knowledge about the disease. Is this research? Yes, this is research, and it is research regardless of whether this activity will result in a publication, because even absent the publication of their findings, the rest of the activities here have all the characteristics of research. There is a question at hand, and the investigators are designing a systematic way to collect information to answer the question. To emphasize, publishing something does not make it research, and not publishing something does not make it a non-research activity. So we have a sense of what is research, but the regulations also outline 4 types of activities that are deemed not to be research. These are scholarly and journalistic activities, and then 3 sets of activities that are government functions with separately mandated protections. Scholarly and journalistic activities involve the collection and use of information focused directly on the specific individuals about whom the information is collected. In some academic fields, like oral history or journalism, a lot of the activities directly concern specific individuals. So the activities would not come under the definition of research because they do not produce generalizable knowledge. The key here is that this carve-out excludes certain activities rather than entire academic fields. This is to say that you could indeed have research or a systematic investigation designed to develop or contribute to generalizable knowledge in fields like historical scholarship and legal research. Let's consider another example. Say that a journalism professor wants to write about the specific experiences of a group of first responders to the 9/11 attacks on the World Trade Center in order to create a record of the events of that day. Is this research? No, this is not research because the professor is collecting information focused directly on these specific individuals about whom the information is collected. The professor is also not drawing any generalizable conclusions from his interviews with these individuals, so this would not constitute research under the definition of research we reviewed earlier, but also under the scholarly and journalistic activities carve-out. Let's look at another example. A group of psychologists starts off with a hypothesis that certain characteristics may render some people to be more susceptible to PTSD following a traumatic event than others. To investigate this hypothesis, they conduct interviews and survey survivors of 9/11. After they analyze the data, draw conclusions from it, and publish their findings in a scientific journal to contribute to the academic literature on PTSD. Is this research? Yes, this is research because the goal is to look for common characteristics that make some people more susceptible to PTSD after experiencing severe trauma. The researchers are explicitly looking for generalizable knowledge here. The other activity that is carved out as a non-research activity is public health surveillance. This carve-out is limited to activities conducted, supported, ordered, required, or authorized by a public health authority, such as the Centers for Disease Control and Prevention, or CDC. And a public health authority is defined as an agency or authority of the U.S. federal government, a state, territory, Indian tribe, etc. The additional caveat to this carve-out is that the activities be conducted by a public health authority, and that they be necessary to identify, monitor, assess, or investigate potential public health trends, signals, risk factors, patterns of diseases, or increases in injuries from consumer products. The activities include those associated with providing timely situational awareness and priority setting during the crisis that threatens public health. An example could include the Florida State Department of Health monitoring an outbreak of an infectious disease, such as E. coli. Let's look at an example and see if it is research or an activity that would fit into the public health surveillance carve-out. State public health practitioners observed that certain young children who had COVID presented with inflammatory reactions affecting different systems in the body. They begin to track the symptom progression to determine how soon after initial infection inflammatory reactions may occur. They write their observations and findings on symptom progression as case reports of what was seen and what was done, and they submit these to journals for publication. As COVID is a crisis that threatens public health, the public health practitioners report their observations to help identify, monitor, assess, and investigate the patterns of COVID infection. Is this research? No, this is not research because there is no hypothesis, no systematic investigation to test the hypothesis, or generalizable conclusions drawn from their activities. The activities here constitute public health surveillance because they are conducted by a public health authority. They aim to investigate the patterns of a deadly virus, and the published case reports aim to provide timely situational awareness during the course of a pandemic. What about the following scenario? A physician reports what appears to be an outbreak of an unusual type of meningitis. A public health authority in the area plans to collect the patient's medical and demographic information to document trends and identify signals and risk factors to better manage the potential public health crisis. Is something like this research? This is likely not research because it fits into the public health surveillance activity to document the trends of the outbreak and to identify signals essential to provide timely situational awareness of something that threatens public health. The purpose of the data collection, the context of why the data is being collected, and the role of the public health authority in this scenario all point to this being public health surveillance. What if we change the details a little? Say the public health authority hypothesizes that certain environmental exposures and lifestyles may result in an unusual form of meningitis infection. They want to test this hypothesis by collecting medical, demographic, and other private information like family history from patients who present at the local hospitals with the unusual form of meningitis to look for a potential relationship between environmental exposures, the patient's lifestyles and behaviors, and the resulting infection. Is this research? Probably, yes. This appears to be research because the public health authority is not conducting the activity solely for public health surveillance purposes. They start off with a hypothesis and systematically collect data to answer their research question. We've looked at question 1, does the activity involve research? And we've reviewed the definition of research and the activities that are carved out from this definition. Let's now shift to question number 2. Does the research involve human subjects? The common rule defines a human subject as a living individual about whom an investigator conducting research either obtains information or biospecimens through intervention or interaction and then uses, studies, or analyzes this information or biospecimens, or the investigator conducting research uses, studies, analyzes, or generates identifiable private information or identifiable biospecimens. A few things to note about this definition. The human subject has to be living, meaning when you're conducting research that only involves deceased individuals, the definition of a human subject is not met. Further, note the about whom. If you're conducting research and obtaining information from someone through, for example, an interview, but that information is not about that individual, but perhaps about something factual the individual is able to share with you, that may not be human subjects research. For example, you're conducting research on the new trends in building environmentally friendly skyscrapers. So you interview an architect to determine the number and locations of new environmentally friendly constructions. So long as you're not obtaining information about the architect, such as her opinions on how changes in political incentives have changed the industry approach to green building, that may not be human subjects research. There are additional key terms in the definition of a human subject. The term intervention includes physical procedures, such as drawing blood to collect a biospecimen. An intervention could also include a manipulation of a subject's environment for research purposes. An example of manipulation of a subject's environment for research purposes could be making a room hotter while having the subject perform memory skills tests to gauge the impact of temperature on cognitive performance. An interaction, on the other hand, includes communication or interpersonal contact between the investigator and subject. An example could be a researcher interacting with a research participant through an interview or a focus group. The definition of a human subject also includes the terms private information and identifiable private information and identifiable biospecimens. So let's take a look at what these terms mean. Private information can be information about behavior if that behavior occurs in a context in which an individual has a reasonable expectation of privacy. Private information can also be information that an individual provided for other purposes, such as sharing their medical history for a medical record, which they can reasonably expect will not be made public. Now, identifiable private information is private information for which the identity of the subject is or may readily be ascertained by the investigator or associated with the information. Let's say that an investigator obtains medical records from a hospital for research purposes, and the medical records she receives include everyone's full name, date of birth, home address, patient ID number, etc. This would be an example of identifiable private information. Likewise, if a researcher were to request leftover specimens from biopsies that were performed for clinical purposes, say biopsies that were taken to confirm a suspected diagnosis of pancreatic cancer, and the specimens she receives include the names, patient ID numbers, etc., of the individuals from whom the biospecimens were collected, we might be looking at the potential research use of identifiable biospecimens. Now, note that I haven't used terms like coded, de-identified, or anonymized. This is because the common rule does not define these or other associated terms. The common rule also does not include a list of identifiers. Let's look at examples to get a better sense of what these terms mean and how we should apply them. Say that a researcher at your medical center has the hypothesis that some of the middle-aged female patients who were hospitalized with COVID-19 and unfortunately did not survive had underlying heart disease that made them more susceptible to the negative impacts of the virus. To investigate her hypothesis, the researcher is proposing to systematically review identifiable medical records of 400 deceased female patients to look for commonalities, like documented high blood pressure and related. So let's ask our first question. Is this research? Yes, this appears to be research because the researcher does have a hypothesis. She is proposing a systematic investigation to test her hypothesis, and her conclusions should contribute to generalizable knowledge about COVID-19 and its impact on middle-aged women with underlying heart disease. But what about our second question? Is this research that involves human subjects? No, this is not research that involves human subjects because the regulations define a human subject as a living individual, and our researcher is planning to look at identifiable medical records of individuals who are deceased. So, while this is research, this is not human subjects research because the definition of a human subject is not met. What about this case? An education researcher wants to investigate the impact of rigorous academic instruction in pre-kindergarten in the United States and the impact this instruction has on a child's self-regulation, mental and emotional health, and attention capacity by first grade. Our researcher proposes to investigate this question by interviewing 250 teachers with experience teaching pre-kindergarten, kindergarten, and first grade, and ask about their opinions on rigorous academic instruction at an early age and their observations of how common it is that children then present with behavioral and attention deficit issues by first grade if they've received rigorous academic instruction at an early age. So, our first question, is this research? Yes, this appears to be research because the researcher is looking to answer her hypothesis through a systematic investigation. The findings of this qualitative study might inform the discipline of early childhood education. What about our second question? Is this human subjects research? Yes, this appears to be human subjects research because the researcher is interacting with the teachers through the interview procedures and collecting information from and about them, including their opinions on this matter. So we have an example of human subjects research involving an interaction. Now, what about a case involving identifiable private information or identifiable biospecimens? Say that a cancer researcher is studying the correlation between exposure to toxic dust and the subsequent development of rare forms of pancreatic cancer. The researcher accesses her medical center's patient record database and looks for patients with a diagnosis of the rare form of pancreatic cancer and documented exposure to toxic dust. She identifies 30 patients who meet these criteria. So the researcher has a hypothesis that exposure to toxic dust has caused a specific genetic mutation in pancreatic tissue. This is the mutation that led to cancer. To test her hypothesis, the researcher collects pancreatic tissue samples that are left over from the routine clinical procedures performed on these 30 patients. The researcher obtains these tissue samples with the patient's name, date of birth, medical record number, and diagnosis code. Is this research? Yes, this appears to be research because the researcher is trying to test her hypothesis through a systematic investigation. Her conclusions could contribute to generalizable knowledge on the correlation between toxic dust exposure and the development of rare forms of pancreatic cancer. What about our second question? Is this human subjects research? Yes, this is human subjects research because the researcher is obtaining private identifiable information about the patients, as well as identifiable biospecimens for the genetic sequencing she is performing to answer her research question. So now what if we change the details a little? Say that we have a researcher who is generally interested in the molecular structure of pancreatic cancer tumors. The researcher arranges to receive pancreatic tumor samples that are left over from routine clinical procedures performed on patients with pancreatic cancer at the local hospital. The researcher receives the samples without associated information about who the samples came from. The researcher will have no means to link the samples back to individual patients. So, is this research? Yes, this appears to be research because the researcher is systematically studying the molecular structure of pancreatic tumors. But is this human subjects research? No, this does not appear to be human subjects research because the researcher is obtaining biospecimens that were left over from routine clinical procedures performed on living individuals. The biospecimens were not obtained following an intervention specifically performed for research purposes. In addition, the biospecimens are provided without associated information that would allow the researcher to link them back to individual patients. Now, one of the most common questions that we get from researchers and IRB administrators is whether quality improvement or quality assurance activities, or QI/QA, constitute human subjects research. The common rule does not define quality improvement or quality assurance activities. But the common rule does, as we've reviewed, define the terms research and human subject. The question to ask, therefore, is whether the QI/QA activity meets the definition of research. So, as we've asked in all the examples that we've looked at, if we're trying to answer whether a QI/QA activity meets the definition of human subjects research, we first need to ask if the QI/QA activity constitutes a systematic investigation designed to contribute to generalizable knowledge. The thing to note is that something could either be a strict quality improvement or assurance activity, or strictly an activity that meets the regulatory definition of research. And some activities will be quality improvement or assurance activities that are conducted for research purposes. So the graphic included on this slide is meant to denote the occasional overlap of these two things. The takeaway here is that calling something QI/QA, or using words like evaluation, etc., does not make the project a non-research activity. The terms are not mutually exclusive here. A QI/QA project can well be a research study as well as a QI/QA activity if it also meets the regulatory definition of research. OHRP has published an FAQ on quality improvement activities, and I do recommend that you take a look at this document by following the link provided on this slide. Per this FAQ, an activity could be construed as quality improvement that does not involve research, if its purpose is limited to implementing a practice to improve the quality of patient care and collecting data on this practice for clinical, practical, or administrative purposes. On the other hand, if the purpose of the quality improvement activity is to establish scientific evidence for the efficacy of this practice, then the activity is a quality improvement research activity. Note that the intent to publish the results of a quality improvement activity is not enough to say that it is a research activity. If there is no systematic investigation designed to contribute to generalizable knowledge, then the quality improvement activity is not a research activity, even if its results are published. Recall our prior examples that involved publication of non-research studies and related. The same can be true for publication of quality improvement activities. Let's look at an example. Is this QI/QA that does not also involve research? So a hospital administrator wants to collect data on the incidence of the 7-day infection rate of patients who underwent surgery at their hospital to monitor the quality of disinfection and staff adherence to hygiene protocols. The administrator is collecting this data with the goal of determining budget needs for additional staff training. Is this QI/QA that also involves research? Well, the hospital administrator here is looking at how often infections occur. There is data collection and analysis to figure this out. But the purpose of the activity is limited to identifying the budget needed to provide additional training to their staff in order to improve the quality of patient care at their hospital. The data collected on the practice is collected for clinical, practical, and administrative purposes pertaining to their hospital only. So, this is probably only QI/QA and not QI/QA that is also research. There is nothing generalizable in this case in terms of the knowledge that is gained. The knowledge gained is specific to addressing budget needs for staff training. Okay, so we've looked at how the regulations define research and when an activity does or does not involve research. And we've also looked at how the regulations define a human subject and when research does or does not involve human subjects. The last question that we need to ask to determine if the regulatory requirements apply is the human subjects research exempt? To reiterate, you would only ask this question, question 3, if you've already answered yes to the question, does the activity involve research? And yes to the question, does the research involve human subjects? Now, to answer the question, is the human subjects research exempt? You would need to consider if the entire study meets the conditions for one or more of the exemption categories described in the common rule. This presentation does not go deeper into exempt review, but we do hope that you will join us for the third installment of this series, which will be focused on the basics of the exemption categories and exemption determinations. What I do want to leave you with is this flowchart, which is a visualization of all the concepts that we reviewed in this presentation. So, if you are trying to determine if an activity constitutes non-exempt human subjects research, you ask these questions, and again, you ask them only in this specific order. So, question 1, is it research? If you answer no to the question, is it research, you stop because the common rule regulatory requirements would not apply. If, on the other hand, you answer yes to the question, is it research, you then go on to ask if the activity is human subjects research per the regulatory definition that we've reviewed. Now, if you answer no to the question, is it human subjects research, you again stop because the common rule regulatory requirements do not apply. But if you answer yes to the question, is it human subjects research, you then go on to ask if the activity qualifies for exemption under one or more of the exempt categories outlined in the common rule. If you answer yes to the question, is it exempt, again, you stop because the common rule regulatory requirements would not apply. But if you answer no to the question, is it exempt, the common rule regulatory requirements do apply, and it is at this point that the study would require IRB review. So when determining that a project is or is not research, that it does or does not involve human subjects, or that it is or is not eligible for exemption, the other thing that I want you to keep in mind is the importance of documenting these determinations and including justification or explanation for your determinations within your documentation. Before we end, I also want to point you to our website for graphic charts that were developed to aid those who need to decide if an activity is research involving human subjects that must be reviewed by an IRB. The link to this page is provided on this slide. And I also want to remind you that OHRP has developed something called a Human Research Protection Training Program. There are currently 5 lessons to this program, and it provides a foundational framework of understanding how the regulations work. You can access this training through the link provided on this slide. We are also here to help you, and we want to answer your questions. Please do contact us if you have any questions related to the regulatory requirements. You can write to us at ohrp@hhs.gov. We will strive to answer all questions we receive within 1 week. With that, I thank you for your time, and I hope you found the content presented in this webinar helpful.